Hi everyone, welcome to week 3 of your Insurance for Pharmacy Technicians course. This week we're going to be picking up where we left off last week in chapter 2. So at the end of last week you were looking at the 3 different parts of the HIPAA law. The last part of the HIPAA law being the electronic healthcare transactions and code sets piece. So this is the piece where it allowed us to exchange electronic data using standard formats. And so the standard formats that we are using in most cases are these code sets that they're going to talk about. So this particular slide is all about the different code sets and how those relate to HIPAA. So I realize that you may or may not have already read through this particular one, but I wanted to make sure that we kind of wrapped up with that in case you weren't sure if code sets were included last week or this week. So just so you know, it does give you some coding examples of how that works, what those different diagnosis codes are, and how those are used. Anyone who is dealing in medical billing and coding are familiar with this. So that's typically the area where you're going to be using these different types of code sets. So even though you may not be using them as a pharmacy technician, you may see them in some of your documents, and that's what it's all about. So we kind of wanted to make sure that you were aware of that. Then it goes on to talk to you a little bit about some of the HIPAA national identifiers. So they're specific to employers, healthcare providers, health plans, and patients. And so it's just, every one of them is just kind of, set up a different way. So you just have to kind of be aware of the fact that there are different identifiers used for each of these different entities. So maybe it's a social security number, or something like that. So it's basically going to take and replace, things like a social security number. So it's used in place of things like that. So that's what that's all about. Then we have the National Provider Identifier. This is 9 numbers and a check digit. This is assigned by the federal government, and this is for identifying providers when they're filing claims or transactions. So this would be not only a physician, but it could also be a facility, a pharmacy, obviously, things like that. And then after you cover that information, they're going to go on and talk to you about some of the other legislation that is going to affect you in the pharmacy. So that kind of wrapped up most of what HIPAA is all about. And then we're going to look at some of the other things. So the Medicare Prescription Drug Improvement and Modernization Act is basically allowing us to provide seniors and people with disabilities to access to more benefits under Medicare. And then we have things like e-prescribing and electronic health records that they're going to talk about. They're going to talk a little bit about freedom of choice. So allowing the patient to choose the pharmacy that they want to use. They're going to talk to you about the Prescription Drug Equity Act, which is keeps us from providing only mail order services. So in other words, you have to be able to have both benefits where you can go face to face to a regular, community pharmacy and mail order. So yes, you can have a mail order option, but we don't want to prohibit a patient from being able to go to that local hometown pharmacy. So that's what that's all about. Then we have things about antitrust and exclusive pharmacy contracts. So basically we can't violate antitrust laws with any of the contracts, things like that. There's laws about healthcare fraud and abuse. So again, here's where we're just, making sure that everyone is following things to the letter of the law. Making false statements, representing, something that's especially gets into things like elder abuse and things like that, and employee retaliation or employer retaliation. In other words, if you report something against your employer, they can't retaliate against you, things like that. So they're going to talk to you a lot about those different types of fraud and abuse acts and how those all work. The other piece that is really important is how do they enforce it? What are the penalties? So this is some of the things that they're going to talk about at the end is what do you have to be able to provide back to show that you are in compliance? So what are you going to do? How can they audit you? Things like that. And you have to have specific components of a compliance plan in order to be compliant. So as you go through the rest of this chapter, if there's anything about it that you find confusing or you have questions on, please make sure that you reach out to me, and have a great week.